Thank you for watching Weekend Prime and welcome back. Now, approximately 15 out of every 100 girls in Kenya begin childbearing before the age of 18. In sub-Saharan Africa, nearly 1 in every 4 girls become pregnant before the same age. Experts say that while Kenya has made progress in recognizing adolescents within its policies, such as the school re-entry program, significant gaps persist in the implementation and coordination of these policies. On this episode of Health Digest, Gloria Milimu interrogates why they are now calling for the inclusion and empowerment of pregnant and parenting adolescents as a strategy to improve their psychosocial well-being and access to services. Take a look.
Teenage pregnancies remain a major public health concern in sub-Saharan Africa, where approximately 25% of girls begin childbearing before the age of 18, resulting in at least 11 million adolescent pregnancies annually. While this stage of development should ideally be marked with these adolescents enjoying a healthy life and just being children as they should, more young girls like 18-year-old Stacey Mweni from Mukuru kwa Ruben slum in Nairobi, who gave birth at the age of 16, are forced to grow up too early in life. They are often confronted with risks such as maternal mortality, unsafe abortion, high rates of school dropout, and poverty.
Ndio nipate mimba, nilikuwa nimeacha shule. Kwetu tuko wawili, niko na sister mbigi. Na mom ni single mom. Sasa tulikuwa tumeingianga shule sisi wote wawili. Ile sasa tumeachana na mwaka moja, yani watu 5 mimi watu 7, mwaka ni moja. Sasa ile time yenye yako ako form 3 anaingia form 4, ndio mimi niko form 1 naingia form 2 tukakuwa beat challenge, alafu sisi wote tuko boarding. Mama akaniambia itabidi wewe ukae wapi, ukae nyumbani ugoje Cynthia amalize ndio wewe ufanye nini uingie. Asi nikakaa home, hiyo mwaka ikaisha. Ile mwaka kuisha December ndio nilipatanga mimba. I think ilikuwa 2024. December date 7.
In Kenya, 1 out of every 2 adolescent girls will become pregnant before she turns 18 years. This often predisposes them to stigma, discrimination, and social exclusion from families, peers, and schools.
When looking at adolescent pregnancy in sub-Saharan Africa, the numbers show us that 1 out of every 4 adolescent girls will become pregnant before she turns 18. In Kenya, the average is 15%, so 15 out of every 100. But that number is very different depending on where you're looking at. So there are counties where the rate is 50%, meaning that 1 out of every 2 adolescent girls will become pregnant before she turns 18. In others, the numbers might be fewer. But the highest in terms of county is about 50%, which is very high.
This young parenting stage also impacts on their psychosocial well-being and access to crucial health services, according to experts.
If we're looking at the health sector, is it that many young people do not have access to, say, contraceptive methods that can help them prevent unintended pregnancy? If we're looking at education-wise, young people may not have the information to fully understand their bodies, to understand their sexual and reproductive health and make informed decisions about the timing of sex. But we must also remember there are many young people who get pregnant because of sexual violence. In other words, they are violated, and that can happen at home, it can happen in school, it can happen in the community. So there are very many different drivers of adolescent pregnancy.
We moved from 18% nationally to 15%. The biggest problem we have is the disparities among counties. Is where we need to address is where the heavy burden counties that are having higher teenage pregnancy. Those are the ones we need to have targeted intervention, not forgetting those that are doing well, because when you neglect them, they also start having an upsurge.
While various interventions have been put in place to address the challenges that pregnant and parenting adolescents face in the country, experts warn that significant gaps persist that impact on the overall well-being of these teenagers. That path to motherhood is often littered with hurdles that require urgent intervention, according to experts.
The challenge that we are seeing in terms of teen mothers is one, tuko na disintegrated policies, programs pia ziko disintegrated. Wale watu wana deal na mental health, wana deal na mental health peke. Wale wa education peke. We need programs that are integrated. Another thing that we have nice policies. Tuko na school integrated, the school return to school policy, but then the return to school policy haiangalii wale adolescents in terms of their diversity, inaangalia in a certain way. Na wakati hata wanarudi shuleni wanapata stigma.
As a country, we do have a lot of policies. We have the reproductive health policy, we have the adolescent sexual and reproductive health policy, we have various policies that touch on adolescents. But what we're seeing is that none of them really, except for the school reentry guidelines, really touch on pregnant and parenting adolescents.
This incoherency in implementation of interventions in health, education, and social protection is what experts warn continues to impact on the high levels of early, often unintended pregnancies in the country.
We think about these young people and we think about, let's not think about what has gotten them to that point, but how do we ensure we support them so that they move forward? And we see that many of our policies perhaps need to better address the needs of pregnant and parenting adolescents. How do we make sure that when this young girl who is now pregnant is able to access respectful care in a health facility so that she gets her antenatal care, she has a safe delivery, and that her child is well taken care of? Our policies need to speak to that.
Yes, the policy is broad. It gives a guide on how these things should be implemented. At implementation level is where you domesticate to suit the situation. So you cannot have a policy covering everything. It's usually a broad statement that guides how we implement. At implementation level is where you address the issue as it is in that county, so or in that area. So we cannot say that we are going to have a mini policy for each and every issue.
Kenya ranks third globally in teenage pregnancies. And while this burden of unintended early pregnancies continue to plague sub-Saharan Africa, coming up with interventions that are tailored to the African context and cater for the teenage parents is what experts advise. Gloria Milimu, KTN.